The burden of chronic disease varies widely across racial and ethnic groups. I'm a nephrologist, so what I know best is kidney disease. African Americans suffer a much greater burden of chronic kidney disease and end-stage kidney disease requiring dialysis. But you can look at many different chronic conditions and see those same disparities. Diabetes, as one example. African American patients, Latino patients, Asian patients have higher rates of diabetes, and the age at which diabetes is diagnosed tends to be younger. If you look at the burden of childhood asthma, Black children, particularly those living in urban areas, have significantly higher rates of childhood asthma than white children. So across the spectrum of disease, racial and ethnic minority groups often have worse outcomes and higher rates of disease. This is true in the United States, but it's also true in the UK, where we see that those of African descent and other racial and ethnic minorities tend to have higher rates of disease, diabetes, chronic kidney disease as examples, and the same is true of Native Canadians. Native Canadians have higher rates of certain chronic diseases like chronic kidney disease compared to those of European ancestry. So I think across many disease spectra, across many countries, we see that racial and ethnic minorities tend to have higher rates of disease and worse outcomes in general.